My name's Neroli Manning. I'm the Managing Director for Cardinal Health Australia and New Zealand. I actually trained as a PE teacher. My first degree was in PE, and I was really fortunate to be given the opportunity to do a summer job and jump in a car and be an account manager or a sales rep, as we were called then. And this was a long time ago. That was a 3-month job, and that turned into several decades now in the healthcare industry. I did a lot more study and have been given some tremendous opportunities along the way throughout my career. I've had some terrific role models, some great mentors that have really helped me to be the leader that I am today. I've taken some twists and some turns. It's given me the opportunity to work in med device, really a lot in the cardiac space. I've had the opportunity to work in capital, which was a really good experience as well. I've done radio pharmaceuticals with an Australian-based organisation for the treatment of end-stage liver cancer, back to med device, and now here at Cardinal Health, actually in a consumables business, which is really where I began 30-some-odd years ago. So it's been a really great career that I've had in healthcare. I've done global roles, I've done local roles, a lot of Asia Pacific work as well, and lots of twists and turns along the way through that experience, but it's been a terrific career. Look, the most recent is really the leadership of this organisation. It's the most rewarding thing I've ever done, and I've had a lot of great career highs. The leadership of this organisation with the leadership team and the prior managing director has been a challenge, but it's been the most rewarding as well. Just developing culture is something that's really, really important to me. I'm a real believer that if you take care of the people will take care of the business. And it's an important cultural element for this organisation. We have a real culture of trust, and high trust organisations perform better as an organisation. And our voice of employee plays out with that as well. So that's been the most challenging, continuing to build that level of trust in the organisation, that high performance mindset and behaviours that is so important, building agility in a time where there's a lot of change on a regular basis. So being agile in today's healthcare world is challenging, but equally incredibly rewarding when we see people evolve and develop through our organisation. We're able to provide opportunities for people to develop and stay with our organisation. So I think that's probably my most recent and most rewarding and most challenging. There's two I'd reflect on. I think the first is the increasing drive for sustainability. Medical devices or single-use medical devices go to landfill primarily. There's a high interest for the right reasons to divert medical waste from landfill and reduce the CO2 impact. It's in legislation now, it's customer expectation now, it's the right thing to do. So there is an emerging interest, an emerging trend, and hospitals and healthcare systems now have a requirement to meet certain thresholds as well. So that's an important trend that we're seeing. We're heavily involved in that at Cardinal Health. We're standing up our own remanufacturing facility here in New South Wales, in fact up near Newcastle, that lifts and shifts 15 years of proven technology from our US remanufacturing facility. So we're super proud of being able to do that, and that is certainly an emerging and accelerating trend. The second thing I'd reflect on is the increased emphasis or consideration of health economics in choosing med devices, consumables for patients, to make sure that hospital systems choose the best medical devices to give their patients the best outcomes possible, but in the most cost-effective manner possible. That's increasingly important in today's world. We all read the newspaper, we watch the news. Medical systems are under pressure, be it the private systems or the public systems in ANZ, or Australia more particularly. So being cognizant of that and understanding that and being able to respond to and talk to and bring medical device technology that helps to support that to bring the best possible outcomes for patients at the most cost-effective way for the healthcare systems is another very important trend in Australia. I'd say absolutely go for it. It's a wonderful industry to be a part of. Lots of different opportunities you can involve yourself in should you choose to. You can be in a commercial role, you can be in leadership roles, you can be in marketing roles. The world's your oyster within healthcare, and I've been really privileged to have been in each of those elements in the med device industry. I'd say back yourself, really continue to learn. Continuous learning, constant curiosity is really important. So read widely, ask questions, ask that next level question to uncover what the problem is. So you're seeking to solve the problem. That would be a really strong piece of advice I would give people who wish to get into this industry. But I would absolutely say go for it. That's a really easy one. Our mission in Cardinal Health is to bring healthcare solutions to patients to do a better job every single day. That's just so incredibly rewarding. Being able to bring really good healthcare solutions to help treat patients and conditions and to help make people well is a very rewarding career choice. Being involved with the people in industry, whether it be our customers, whose job it is to do that every day, or with our own internal teams, is just an incredibly rewarding place to be. So the passion comes from the people and the outcomes and the solutions that we provide to make it a better place every day. So I'm married to a South African. We love to go to South Africa and game drive. We spend a lot of time self-driving in the Kruger Park. It's just the most beautiful place. If you haven't been, I sound like a travelogue, go. It's beautiful. The animals are extraordinary. The landscape's incredible. So we get to South Africa as often as we can do. So that's a real passion for both of us. I love to cook. We love to entertain. We love to spend time with our friends and family. We have a little itty bitty farm up in the Hunter Valley that we go to, and we spend time in our garden and entertaining and being with friends and family. So that's a real source of pleasure for me.